It's time for us to talk health in the health segment. And as you know, this month is Cervical Cancer Awareness Month, and we've been talking all through so far, having different conversations and all of that. So we're going to continue today, and our guests from last week are back with us, and Dr. Ayongo Annan and Dr. Gifty Sunkwa Mills. They are both here, and we're going to be talking to them. Just good morning. How are you?
Good morning.
Good
You're
morning.
good?
Fine, and you?
Welcome back. Welcome back.
Thank you.
Thank you.
Yeah. So how has the week been since the last time you were here?
It's been a very busy week because we have been doing a lot of awareness, creating awareness in several places, on several radio stations, in several institutions, and also doing screening for cervical cancer since we came here. So it's been a busy, interesting, and productive week.
Okay. In your quest to create more and more awareness, what's the most important focus for you?
Okay, so for us, the most important focus is to get people to understand that this disease takes a long time to develop, cervical cancer, and then they need to screen and to prevent this condition.
Yeah, okay. So they need to screen. Let's do a recap of what we did the last time. Tell us about the need to screen. What are the screening methods? Encouraging people to come in to the hospital to get screened, and so on. Just take us through.
Okay, so the main screening methods we have in Ghana are three. We have the human papillomavirus test, we have the pap smear, and then the visual inspection with acetic acid. So those are the three main ones we have, and they are available in many centers. We gave the centers to you. Many of the centers are doing a Polyclinic, Ridge Hospital, a number of centers. So you just get to anywhere you ask. If they are not doing it, they'll redirect you to where it's done. Okay. And we always advocate that for people who are between 9 and 15 years, they can do the vaccination. Yeah. They can be vaccinated. It's more effective at that age. It's 9 to 45, but at that narrow age of 9 to 15 years, it's very, very, very effective. And they need 2 doses instead of the 3 doses for the other ages. Yes. So basically, we went through also the screening that it's not painful. Yeah. It's a bit uncomfortable. Yeah. But it's not painful. It's not different from a pelvic examination or if you've had a baby before. So those were the few things we discussed last week. Yes.
Let's talk about treatment. So you've done the test, it came out positive. Let's look at the psychological aspect and then what it is that you do to treat.
So when you do the test, like any other test, it will go 2 ways. It could go negative or it could go positive. Yeah. Like we said last week, it's a very long time from persistent infection with HPV to actual manifestation of the symptoms of the cancer. Now, when you screen and it's positive, you would be asked to do further tests because beyond knowing it's positive, we want to know the stage at which the disease is. There are various stages at which the cancer progresses. There are the early stages where treatments will be immediately available and effective, and there are later stages which require more intensive treatment. I mean, beyond, after being diagnosed, you would go through some routine tests, checking your blood count and other parameters. Yeah. And then, based on the diagnosis, a treatment regime will be brought up. There could be various dimensions of treatment, ranging from surgery, ranging from chemotherapy, radiotherapy. So the treatment actually depends on the exact stage at which the disease is diagnosed. But for visual inspection under acetic acid, I mean, at the very early stages, we could actually do some cryotherapy just to solve the problem there and then. Yeah. Okay.
All right. Now, last week when you were here, there were a number of questions that were asked, and I want to read some of those questions. Our show is interactive, so people send us questions about topics that matter to them. And it looks like cervical cancer is definitely one of those things that people are very concerned about. So. This one says, good morning. I am Nene Kria from Adenta. Thank you for educating us. To my concern, I have done the test twice, and I was negative, but they did not vaccinate me. What should I do now?
You should go ahead and do the vaccination.
Where?
There are various centers, and I think we shared a long list the last
for instance,
time.
Lister is vaccinating, Akai House, Mission Clinic, Bato, they are also vaccinating.
Okay.
Yeah, so any of these areas she can get to, and then
all right,
she'll get the vaccine.
Okay, so this one says, this is from Vadis in Chroma. It says, my question is, can boys also convey the organism, I guess the HPV is what you're talking about, to their partners? And if so, I don't understand the question. It says, if so, how do we carry them? How is it transmitted? I guess that's a question that is being asked. Can guys transmit to their partners?
Yes, guys can transmit to their partners.
Okay.
Through sexual intercourse.
Okay.
You can transmit to their partners.
As simple as that.
As simple as that, yes.
Okay,
so that is why now the vaccination is also targeting both boys and girls.
Okay.
And like we said, it's not only penetrative sex. We've talked about oral sex. We've talked about even fingering. So all these should not be excluded. The various modalities.
So any body part that comes into contact with HPV,
yes,
we can transmit it.
Yes.
Okay. All right. The second question here is after the same person, after the organism has been deposited for a long, let's say 10 to 15 years, what would be the first sign for you to know that there is cervical cancer?
Like we said the last time, there are a wide range of symptoms. So there isn't a particular sign that we would say this is the first thing you will see. Somebody may start by having bleeding in between their menstrual periods. Somebody may start by having bleeding after sex or pain after sex. Somebody may have an abnormal vaginal discharge. So there are a wide range of symptoms, pain. Any of them could manifest first before the other. People are different in the way they show
the last question that is being asked here is after testing positive, can it be cured or controlled by drugs?
Okay, so the thing with HPV is that if your immune system is within normal limits and you are not exposed to any of these risk factors that we mentioned, it's likely you are going to clear it out of your system. Your system will just clear it within 2 years, it's gone.
Okay.
So that is, so in a case like that, if you are positive, we sort of monitor. And then you look out for the signs and symptoms we talked about, and it still doesn't change your screening schedule. Okay. So you still get your screening done. Okay.
So if I'm understanding you correctly, you can get HPV.
Yes.
And you can get rid of HPV.
Exactly.
Without ever getting cervical cancer.
Yes.
And without ever even necessarily knowing that you ever had HPV.
Yes. Actually.
Okay.
We have an immune system that fights a lot of things without us even knowing.
Okay, good
but don't take the risk.
Well, of course.
Get screened. As somebody said, get screened, and there's a vaccine for cancer. Take it.
Yeah. All right. Okay, good.
Yeah.
So this one, I'm not sure it's related, but it's still a question that's been asked based on the show that we did. I did an abortion February 2013, and due to that, I have been discharging, a brownish discharge, and it has a strong scent. I've been to hospital for labs and all of that, but I'm still discharging. What's the way forward for me?
Okay, so this one would need a bit more history on what she did, how the abortion, was it done in a hospital, did she do it at home, was there a cleaning process of the uterus or something, was she given antibiotics? We don't know any of those things, so we need a background information of all that. But certainly she needs to get to a hospital and get checked for this kind of thing. Yes.
Okay. All right, good. Well, this one here is it's from a guy. He says, I'm Frank Ocheri from Kumasi. I want to know the causes. Now, obviously, the big one is the HPV. We know that. Are there other things that can trigger the onset of cervical cancer?
Okay, so those are what we call the risk factors we mentioned, as in like early onset of sexual activity, multiple sexual partners.
Okay, so let's do some clarification here. Early onset of sexual activity. So there's no HPV on site, but the fact that you started early can trigger it.
Yes.
Okay.
Because the fact that you started early can enable you to contract HPV.
Okay.
Yes.
So
And
HPV
then the
is
changes.
in the picture.
It's still in the
HPV
picture.
HPV is associated with 99.7%
Exactly.
of all
good.
causes
So that's
of
what-
cervical cancer.
Okay, so that's
Yes.
that's very important to know.
Yes, 99.7%.
Okay.
Yeah.
Okay. All right. So early onset is just increasing your risk.
It's increasing your risk.
Okay.
The earlier you contract it, the more it stays within your system. If you
Yeah.
have that kind of behavior
Okay.
and then interacts with the system, and then it can cause the...
Okay. All right. Okay. Great.
And there are other factors like smoking and lifestyle, obesity, which have been known to be also risk factors in this. And also
but
having...
there are also risk factors for other cancers as well.
Yes, they
isn't
are.
it? So,
And
Okay.
having immunosuppression, other conditions that give you
Okay.
immunosuppression.
Okay. Right. Another question. What are the effects of HPV vaccine on girls with respect to childbearing in the future?
So far, the research has not shown any effects of childbearing.
Okay.
Yes, but let me say that there's still ongoing research. But for now, it has not been known to compromise childbearing or, prevent anybody from being able to have a normal childbearing history.
Okay. All right. So side effects of vaccination for cervical cancer. Side effects.
No. I mean, everything has side effects. Even taking paracetamol can have a side effect. But these ones are not the severe side effects that are, maybe be pain during the injection, or just a few kind of side effects, but not something that should deter one from getting the vaccine taken.
Okay.
Yeah.
So Toby says, I'm 30 years old. Can I take the vaccine?
Yes.
Okay. Simple one.
Yeah.
All right. So another question here says, I went to the hospital for the test. They could not find my cervix. What does that mean?
It's hidden.
I've been asked to go through. I've been asked to go for further tests, though.
I can't. I don't have the full. Like I say, we need a full history about what happened.
Picture of what's going on.
But sometimes the cervix can either go below posteriorly or it can go above. So sometimes you may need. It may depend on the expertise of who did the equipment they had and all that. But sometimes it can actually be above or below. You need a few more maneuvers. I mean, it was a very interesting case we had once. We had to actually kneel down.
Oh, really?
We couldn't sit on a chair to find. We had to actually kneel down and then reposition the speculum before we located the cervix.
Interesting.
Yes.
Interesting. Okay, so yesterday we had an interesting conversation with one of our guests who talked about her story, and how it was that she had cervical cancer. And she's a survivor. So in the story, I think that a lot of things got jumbled up and confusing for our viewers. So there's a whole lot of questions that came, and I'm going to pose the questions in a summarized form so we can just address the issue. So basically, what a lot of people want to know is, number one, what is the relationship between IUDs, intrauterine devices, and cervical cancer? Is there any relationship whatsoever? Any of you can take it.
So let me say that people have their stories, and people should tell their stories. And when people tell their stories, you should take the key lessons from these stories. With respect to IUD and cervical cancer, there has been a lot of research which has so far shown that there is no association between cervical cancer and IUD. I mean, there have been various research at different points, and there was actually research that showed that it could have a protective effect having an IUD.
I see.
There has also been research that said there was a weak variable association taken into consideration confounding factors. So in all these things,
when you say confounding factors,
there are many other factors.
Okay.
Like, have we looked at sexual exposure? Have we looked at the person's smoking history? Have we looked at the person's diet? Have we looked at other possible comorbidities or coexisting diseases at the time? How long was the person screened prior to the research? Things like that.
Yeah.
Because you could, for instance, have an IUD, but you haven't had any screening in the past 5 to 10 years. If there was something happening in those 5 to 10 years, when you finally find it, I mean, would you associate it with the IUD, or could you say that we might have missed it in the past 5 to 10 years when you didn't get screened?
Yeah.
So these are the things that we should look at and not conclude.
So it's possible.
Yeah.
So it's possible. Let me ask another question before I draw a certain conclusion. IUDs, what's the likelihood of corrosion of metallic IUDs? I mean, I know that in modern times we've sort of shifted and we've come with some newer versions of IUDs, but originally there was the copper ones. I don't even know if it's still in use. Are they still in use?
Well, the copper T is still in use.
The copper is still
Actually,
in use.
there's a label for it. It's copper T 380 or so now, currently in use.
Okay.
And I believe that probably the copper has evolved. As in like different, so there's a raw copper, then they sort of modify, they sort of peptide. So now copper T is still in use and it's working perfectly. There is also the Mirena, which is the plastic type, but that one is given, well, if a person requests, or if you have other issues, hormonal issues, dysfunctional uterine bleeding, and other conditions. But one thing we should always know is that all these things, you discuss it with your doctor.
Yeah.
That is why we say have a culture of, if even you are fine, don't wait till it's only pregnancy.
Yeah, before
you go to the clinic, you see your obstetrician or gynecologist. Go there, have a chat. You're going to put an IUD, have a chat. You're going to get a lot of education, and then you make an informed decision.
Yeah.
Yes.
Okay.
So people who have IUDs or any other form of family planning should also remember to check, to be screened every 2 years, as we recommend for everyone else.
Okay. All right. Yeah. So is it possible that somebody can have cervical cancer, but you're not well, I mean, it's there. The HPV is you have HPV. Yeah. Actually, I think that's a better way to put it. Yeah. So somebody can have HPV, and then you happen along life's road, to decide that, look, I don't want any more children, so I put in the IUD. And then there are complications of different things that happen. Is it possible that coincidentally we're looking at a situation that somehow HPV has already been present or became present after the IUD was inserted, and therefore in the diagnosis of cervical cancer, it has nothing to do with the IUD per se, but it's actually being diagnosed.
Like my colleague rightly mentioned, there's no known research that links IUD with cervical cancer. But like you mentioned, was it already brewing? Did we miss it because of lack of screening?
Okay.
That may be a considering factor to a thing like this. Yes.
Okay. That's possible. All right. So we are going to have, thank you very much to our doctors, Dr Gifty Sunkwa Mills and Dr Ayongo Annan. We're going to have a quiz next week, Tuesday. We're going to have a quiz. Now, for those of you who are watching, you would want to stay tuned and watch next week, Tuesday's episode as well, because the quiz is going to basically be on cervical cancer. And the questions that we're going to be asking, 10 questions on what we've learned so far about cervical cancer. So I hope you watch today's episode and you're going to re-watch it on our YouTube channels and on Facebook and so on. And the top 3 people at the end of the quiz will be awarded with free screening. If you're a male or you're a guy, the free screening will go to female of your choice, okay? And then also some Lexter products will be made available to you as well, okay? So that's something to look forward to. Next week, Tuesday. Watch and repeat and keep watching again because the quiz is going to come.
Hi there. I hope you enjoyed the show. Don't forget to subscribe, like, comment, and share with all of your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.